cases are climbing across the nation. That includes right here in Rhode Island.
Yeah, the respiratory infection is highly contagious, with most cases seen in our children. NBC 10's Temitope Atalaya is live in Portsmouth, where its high school has seen a few cases recently. Temitope.
Dan and Tamara, Portsmouth School Superintendent says there are at least 4 current cases of whooping cough here at Portsmouth High School, but this matter isn't isolated to just Portsmouth.
I'm just wondering why we had this whooping cough, what caused it, where it came from.
Diane Pantig is the grandmother of a Portsmouth High School student. She is trying to figure out why cases of whooping cough, also known as pertussis, are increasing.
We have had this increase in whooping cough over the past 6 months or so. It really kind of peaked more in the summer, so not surprising that we're still seeing it now that the kids are all back in school and, hanging out together. It makes sense.
Whooping cough is a highly contagious respiratory infection, and while it's not at all unusual, it is on the increase. State epidemiologist Dr. Suzanne Bornschein says they have seen 224 cases in Rhode Island since April, one of the highest number of cases in a decade. She says 80% are in the 5 to 18-year-old age groups. 8 to 9% are in children under 5 and about 11% in young adults.
And what is interesting is about 88% of the kids are up to date, who are younger than 18 are up to date on those vaccines, which is great news.
So with 88% of children protected, why are we seeing numbers this high?
Several factors at play there. And one, of course, is that during the pandemic, we probably didn't have as much exposure to the usual childhood illnesses. We also know that this vaccine is a good vaccine, but it's not 100%. So we are going to see some cases, even in folks who are fully vaccinated.
Symptoms for whooping cough are a head cold, fatigue, fever, runny nose, which can result in a persistent cough similar to the flu or COVID. The state recommends making sure your child is up to date on their Tdap shot or booster and taking them to a pediatrician if you think they have whooping cough.
Get your kids vaccinated.
The Rhode Island Department of Health says it is still researching the bacteria that forms whooping cough to see whether its structure has changed, possibly leading to more of the cases that we're seeing today. Live in Portsmouth, Temitope Atalaya, NBC 10 News.